I'm Doug Powell. I'm the director of the Patch Test Clinic at the University of Utah. I've been doing this for 12 years.
I'm Crystal Davis. I've worked with Dr. Powell for 8 years now, and I'm his patch test coordinator.
Patch testing is when you look for an allergy to an external allergen. An allergen is a chemical that your immune system reacts to, and it causes a rash or an itch or some other symptom that's problematic for the patient. At this time, the most common allergens we are seeing are probably coming from shampoos and soaps. Although it's a long name, methyl isothiazolinone is the current allergen of the year, and it's out there a lot. A lot of people are reacting to it. Methyl isothiazolinone is a preservative. It's put in shampoos, soaps, cleansers, baby wipes, and preservatives are chemicals that are added to personal care products so the bacteria, mold, and fungus don't grow in those products.
To bring the things you're putting on your skin: soaps, lotions, shampoos, conditioners, creams, ointments the doctors have given you, because every once in a while doctors prescribe something you actually are reacting to. And we have people bring suitcases full of stuff, so don't be shy about bringing. We actually want the product and the container because we want to see the ingredients that are actually going on your skin.
You'll come into that first visit and you'll meet with me, and we'll go over your history. We'll talk about where the rash is, how long it's been going on. We'll start to come up with ideas of things that we ought to be looking for. We'll pour these chemicals into little chambers on the tape. Admittedly, I don't do the work. My staff does it. Then we'll apply these chemicals or the pieces of tape to your back. We'll reinforce them with other tape.
Many patients want to know how many allergens we put on their backs, and for the most part, I would say average is about 120. We recommend no exercising. A gentle walk is okay, but you really can't bend or do much movement, at least these first 2 days. And then the other reason we recommend really no exercising is because you can't get your back wet for the entire week, and not many people want to be smelly all week.
So 2 days after I see you, we bring you back, we take the tape off, and we use a little highlighter to mark your back with a grid so we know what chemicals are where. Then we have to let your back calm down for about 15 to 20 minutes because often there's irritation from the tape. Then I come into the room and I look for little red swollen reactions as an indication of an allergy. Then I go through and we have handouts to explain what that chemical is and where you're exposed to it. Then we print off a list from our database, a list of products that are free of that chemical. And we say, okay, here's what I want you to do. I want you to stop using those products you're using. I'm going to switch you over to these products. And it takes a while for the rashes to calm down. So I'd say about 50% of the time we can find an allergen that if we remove it from that person's life, we can improve their condition significantly. Now, if we don't find an allergen, I still think it behooves us to do something to improve their condition. I mean, by the time people get to our clinic, they're usually really tired of the rash, and it's affecting their life quite significantly. And so we have other treatments, other modalities that we can use to make their dermatitis better. "50% of the time is really good. If I was Major League Baseball, that's great batting average." But it's our commitment, our theory is we're not there to just find allergens. Really, we're there to make the patient better. So whatever it takes, whether it's finding an allergen or if there's no allergen, come up with something else to treat the patient. Our commitment is to help the patient.